Annyeong Haseyo. My name is Dr. Veronica Muskies Edwards, and I am the chair for the International Organization for Standardization, or ISO, Technical Committee 304, or Healthcare Organization Management. ISO is a non-governmental international standards-making body headquartered in Geneva, Switzerland. The committee is made of member countries that nominate global experts who work on subcommittees to collaboratively create best-in-class standards and technical specifications. Building a pathway towards excellence in healthcare organization management was the foundation for TC 304's creation, and we focus on the non-clinical operations in healthcare entities. The Republic of Korea is a highly participatory country in the Committee for Healthcare Organization Management, and we are extremely grateful. It is a true honor to be able to present today to one of the world's most highly industrialized nations. The Republic of Korea is ranked in the top 10 countries in the Global Innovation Index scores for 2020. This great achievement is linked in part to its highly skilled and educated workforce, fostered by strong government support. One important area in which the Republic of Korea excels in the global innovation rankings is knowledge creation and knowledge diffusion. I can tell you from experience working with our Korean experts that this is true, and I would like to take the next few minutes to tell you why. We are all sadly aware that the world changed drastically in 2020 with the pandemic and still continues to change daily. COVID-19 exposed gaps in previous and current global healthcare organization management support systems, such as delays in manufacturing and distribution, which led to critical shortages of personal protective equipment, such as N95 masks, gloves, and sanitizers. Physicians, nurses, mental health professionals, and home caregivers continue to be in short supply and at times subject to quarantine, leaving sick individuals without the proper attention. Telemedicine systems were caught unprepared, and the demand for quality telehealth alternatives increased exponentially. Existing electronic medical systems and data sharing capabilities were not adequately advanced as to provide the needed sharing of patient information in a timely and seamless manner. And finally, shared practices and communications were inconsistent. In response to these problems, Technical Committee 304 has been presented with opportunities to help health systems better confront and manage the disastrous effects of the pandemic. Notably, the Republic of Korea has received worldwide recognition for its management of the COVID-19 pandemic and for its effective outcomes without resorting to strict border control and lockdown of its own citizens. The Korean case has been studied as one of the potential models for successful response to the COVID-19 pandemic. The leadership of TC 304 are grateful for the Korean Standards Association's rapid response to help in the fight against COVID. Never before in the history of our technical committee has one country's standards body acted so quickly and comprehensively to present multiple proposals for much needed timely standards. Specifically, KSA experts began to work on the following group of pandemic response standards: drive-through screening stations, walk-through screening stations, emergency treatment centers, self-system checker, and social distancing and source control. The average process for standards proposals, draft, writing, voting, and publication can take up to 36 months. However, the Korean Standards Association was extremely well prepared and organized and has been able to speed up the process for these much needed standards. In fact, the standard for drive-through screening was due to be published in April of 2022, but is moving along so well that we believe it will be published early in the fourth quarter of 2021. Similarly, the standard for walk-through screening stations, which is due to be published May 2022, will more likely be published early in the first quarter of 2022. I would also like to share briefly with you some of the most recent initiatives that have been sponsored by other member countries. A new standard project for telehealth, originating in India, was recently approved and will start soon. Very enthusiastic experts from the United States and United Kingdom are now leading the creation of a standard for healthcare quality management. Other projects under consideration addresses vaccine administration and comes from our colleagues in Poland. Indeed, over 100 experts from multiple continents are currently investing their passion and knowledge in the development of these standards, and we invite and welcome more Korean experts to join in these projects as well. So what does this mean for the world? First, thanks to the Republic of Korea's efforts, countries around the globe will have access to scientific best practices for the screening of COVID. This will enable them to perform screening in a safer, more efficient, and reliable manner. These standards will also increase screening efficiencies, reduce the waste of valuable resources, and decrease the spread of infectious disease. Second, the world will benefit from the Republic of Korea's proven expertise on how to set up emergency treatment centers. These centers are critical for isolation and monitoring of patients with no or mild symptoms of COVID-19 during a pandemic. These facilities are also an efficient alternative that relieves severe medical resource shortages, which is very important in resource-poor countries and communities that struggle economically. Finally, it is my hope that other countries' standards bodies take note of the work that is coming out of the Republic of Korea and that they are inspired to also share their evidence-based best practices in the creation of international standards. As I mentioned earlier, I recognize and respect global innovation rankings showed that the ROK leads the world in knowledge creation and knowledge diffusion. We can truly see this in action, as evidenced by your commitment to share knowledge that diffuses throughout the world as a member of ISO TC 304. I cannot end my time with you without extending a special thank you to Dr. Jong-Won Kim and his highly qualified team. He is a respected convener of 5 standards, which is a large task with much responsibility. In closing, Technical Committee 304 for Healthcare Organization Management values the important work that is put forth by the Republic of Korea, and we look forward to future collaboration. I personally thank you, and the world thanks you as well.